Hi everyone, this is Shahir, marketing lead from Slaritas Digital. How are you all?
Shy. We have a shy audience. Okay, we have a few more people joining.
Yeah, I think it's gonna take some time at the beginning until they can join.
Yeah, that's quite all right. Okay. Yeah, so just to kind of reiterate, here at Solaritas, we always have uh, the discussions on some of the top intersections between veterinary technology or between animal health and technology in the veterinary industry. And so this brings us to our facilitator today, who I want to give a brief introduction to, though I know no one can be introduced better than they can themselves. But I'll give a few brief words on our facilitator today. We have Dr. Saada Kandil, who is a veterinary surgeon with 8 years of experience in medical care, surgical procedures, and preventative health care, who's based in the UAE, and she's given proven expertise in diagnosing illnesses, conducting surgeries, and managing veterinary teams. She's passionate about animal welfare and actively participates in volunteering campaigns and is dedicated to promoting responsible pet ownership and advancing veterinary standards. So I'm very happy to have Dr. Kandil here today to talk about implementing telemedicine in small animal practices. I know she's mentioned this is kind of a topic of budding importance in the UAE, and that it needs to be spoken about more. And so I'm very excited for us to kick off that conversation. But I'll pass the mic over to Dr. Kandil to kind of give an introduction on today's discussion now.
Thank you for all this introduction. It's amazing. So, good afternoon, everyone. I'm Dr. Saada Kandil. I'm a seasoned veterinarian with a passion for the small animal medicine. Here today, we are going to do an open discussion regarding the trend now. It's becoming very trendy. It's about the telemedicine. Actually, this topic is very new in the Gulf countries and the Middle East as well, but it became more validated in USA and Canada. It's well established now there. So we like to go through this topic and know more about the meaning of these platforms and what are the benefits, what are the uses. But before we can start with a brief intro about my expertise. So I was graduated from Cairo University, School of Veterinary Medicine, and afterwards I worked alongside with passionate board certified professionals for so many years. And as a passionate with education, I used to teach in the School of Veterinary Medicine at Badr University, where we established there the pet clinics in order to enhance the hands-on learning for students. Although we established so many campaigns for stray animals, campaigns for One Health. It was a big campaign between the university and in Egypt and the Leibs University in Germany regarding One Health, and it's kind of communicating the whole medical sectors to raise awareness about One Health. Afterwards, I traveled to UAE, and where I'm established here now, and I established the Vida Vet Clinic, and now I'm pursuing my Canadian board certification. I hold a certification from Improve International UK in corneal surgery, soft tissue surgeries, and head and neck surgeries as well. So, about our topic today, are we ready to start now, Jahir? So Danielle, are we ready to
Yeah,
start? So
I think we should be ready. Yeah.
all right. So is the screen obvious?
Yep, we can see
All
this.
right. Yeah. All right. So today our webinar is gonna be about telemedicine. But before we start, I like to discuss first this logo or this sign. As we all see now, it's something very common to see nowadays. It's very familiar with us now to see this common sign. I'm not sure if all of us, if all of the participants today, they saw this sign before, but it's kind of a move that started on October 1st, 2014, under the name of Not One More Vet. And it was established in response to the heartbreaking suicide of vets. It's kind of veterinary mental health community where veterinarians could share their challenges, offering each other a lifeline of understanding and support due to a lot of challenges that we face in our daily workflow. And these challenges lead to higher suicide rates and mental health struggles. I prefer to start with this part of our profession because it's a very common struggles, and we are facing a lot. And unfortunately, these struggles led at the end to a high suicide rates in the past few years. Let me mention simply and a quick a quick brief about these struggles. We have the professional pressure, like the emotional exhaustion from managing intense emotional connections with clients and animals, like the high stress due to life or this decision making, emergency situations and workload, the long hours due to extended work days, work evenings or shifts, weekend shifts, and on-call duties. And don't forget also the debit burden due to a high educational debt and financial pressure. Not only actually this professional pressure, we have also the psychological part, the empathy overload that we should have every time to absorb the client's emotional distress. Sometimes we feel guilty and self-doubt by second guessing due to second guessing diagnoses and treatments, the extreme lack of support due to insufficient resources for mental health, and also the perfectionism, the unrealistic expectations for patients' outcomes. Actually, there are a lot of factors that affect our physical and mental health and sometimes lead to the suicide, and that's what we faced in the past few years, unfortunately. Why I'm mentioning all these obstacles? Simply because I like to remind us how all these challenges can be milder if we started to use the technology in our profession. First of all, thank you for this move and for the founder, and for sure, second, thank you for the technology for being a game changer and a lifesaver. And what I mean by technology here, I mean the telemedicine and AI as well. So first of all, let's explain a brief about the telemedicine for who is not familiar with the meaning of telemedicine, how it looks like, how it's applied in our veterinary facilities. So regarding the title, telemedicine itself may not be very well known, but you will realize that you are doing that many times during your time or during your routine daily work. So the question here is, are we doing telemedicine without knowing it's telemedicine? In fact, the answer is yes. Actually, I am one of the vets who are doing telemedicine before realizing that it was telemedicine. But now, due to the technological advancement, it became much more easier, more common, more successful due to the common platforms and the very advanced features that they have and they offer. Then a telemedicine is a kind of a way which allows a pet parent to seek a vet advice about non-emergency situations that don't require a clinic visit. How it goes, actually the pet parent can get the medical service through a secure portal where the vet can access their electronic medical record database, and of course it's gonna be a kind of a secure part due to the privacy and the confidential part of the medical records. So regarding the types, we have actually three types. We have three types in telemedicine. First one is a kind of store and forward. It's used in storing, sharing of medical information like the CT scans, MRI, X-ray, photos, videos, and text-based patient data. And this actually mainly is done between the general practitioner vet and the specialist. So it's gonna save a lot of time when you have this portal in your facility to connect directly with a specialist to get his opinion in something emergency, or you need to take a decision. So you are gonna save a time just to text him directly or get in contact with him directly. You will get the answer as soon as possible, so you will do the right decision after. The second one actually is something related more to the chronic disease. It's a kind of remote monitoring, and it involves the health data being reported, collected, and evaluated. For example, like the blood pressure, like heart rate, oxygen level, respiratory rate. And actually, this part of telemedicine is gonna be a game changer in the chronic disease. For example, here I have an example. If we have, for example, a pet, he has a chronic problem like cardiac problem or diabetes or kidney failure, something which is needed to be monitored at home. So the pet is going to wear a wearable remote sensors, and we have a lot of devices now. A lot of remote sensors now are available in the market, and at home, these remote wearable devices is going to record everything like the heart rate, respiratory rate, the sugar level in the blood, depends on which disease is actually. And then the owner is gonna schedule a monthly virtual visit with the vet. The vet will receive the data from the wearable remote sensors. Then the vet team is going to analyze the data. Afterwards, the vet is going to recommend like in-person office visit when needed, or it's gonna schedule another follow-up appointment, whatever the situation recommends. And regarding the wearable devices, also there is an old webinar here in Clarice's I liked so much. It's about these devices. There are actually Dr. Ross mentioned a lot of them and mentioned a lot of features about them which are available now in the market. And they are amazing, like the remote thermometer, remote stethoscope, and so many others. They can be used actually during the virtual consultation or even monitoring the chronic disease at home. And we have the third one. The third one is a kind of real-time video communication, and this is what we are going to discuss today. This is the main type of telemedicine that we need to raise awareness about it. It's a kind of a direct communication between the pet parent and the vet for primary care, for follow-up, for medicinal prescriptions. And this is mainly our main type for today, actually. So from here, we can highlight the multiple uses and advantages for this technology in our veterinary practice. What could be the uses that I can get the maximum benefit from this platform in my profession? Let's imagine the situation that we all faced during the pandemic, COVID-19, or any other pandemic situation we might face at any moment. You can use this technology to do a triage. You can use it to do a screening for symptoms. You can monitor symptoms and the recovery from any disease. So it's gonna help you with a faster testing. It's gonna help you to increase the number of vets that can monitor at once. It's gonna help you to prevent the emergency rooms from becoming overwhelmed. So it's gonna be very beneficial at these situations. Beyond the pandemic, for sure, we have a lot of other many uses. like the general health care, such as the wellness visit, the blood pressure control, non-emergency follow-ups. We have so many also behavior counseling, like, and also nutritional counseling. Sometimes pet parents, he just want to ask about the routine diet, what's the most important for his pet, what's when he gonna stop this kind of diet, when to start the other one. So there are a lot of vet advices that the pet parent are seeking, but sometimes, of course, they may delay it, or
بعمل
they
كده في
may.
الدراسة. في أولاد غدا ما مالش خدات عندي.
So the pet parents are seeking the vet advice in these situations, non-emergent situations, but he may delay it, or may like disturb. Doesn't want, for example, to disturb his schedule, or he has no time for any reason. His pet is difficult to be carried in a car, or a heavy pet, or he is like lazy to chase the cat, to put her in the cat carrier and go to the vet. It's a lot of obstacles that are facing actually the pet parent during the daily visit, or before scheduling an appointment with a vet. So we need to make it much more easier for them to take the decision to, okay, it's fine, I can just click on this app, I can just communicate whenever I have no time, or whenever I am ready, so I can just get in contact with him directly whenever it's suitable for me. So beyond the pandemic, also there are a lot of benefits, as we see now. So here's the benefits with the pet parent. So as I explained, it's gonna be somehow a comfort and convenient tool for the pet parents, because it's gonna be a stress-free, as this need to put the pet in a car and like leave a work. Adding to that, it cuts off also the waiting time, and it allows the pet parent to arrange the consultations around their busy schedules. That's how it becomes so convenient tool, especially that we all know that the pet parent, first of all, to come for a clinic to visit, they choose the closest spot to them and to their pet, which makes sense. Not only the location, but also they look for a good spot where the parking is easy, convenient for the whole process. If the pet is somehow aggressive, so he doesn't prefer to expose him to a lot of other pets, to the smell in the clinic. So that's bring us to the second reason why it's became so important to implement telemedicine, which is increased access to care from distance. If the pet is living in a rural or remote areas, so it's gonna help them providing the needed advice from the vet and define the situation. If it's an emergency situation, they need to move directly to the ER, or it can be successfully controlled at home. For example, there is a very common problem, comes to all of us very often, when we suddenly receive an obstructed cat, and has been like this since a while because his owner hadn't enough time to schedule an appointment for any reasons, thinking that is not a big deal, which lead at the end to a very serious complication. And the pet is coming to us in the clinic as an emergency, and we have to relieve his obstruction, and all of this because of the delay from his owner, due to any obstacles that he is facing. Adding to that, being a cost effective, as telemedicine consultations can be more affordable than the vet visit. And when we mention a cost in veterinary medicine, as all we know, it's one of the main factors that may hinder the pet to be examined, or can be a reason for a long delay in a consultation and diagnostics, especially for the pet owners who are truly love their pets, but they cannot afford the consultations and the diagnostics. So all what they do is to delay it until it becomes uncontrollable or lead to severe complications. That's how the pet owners will be encouraged to get their pet checked whenever needed, despite of the cost or the need to make an appointment and adjust the schedule and carry the pet to go. So it's gonna be much more easier. Regarding the pet parent family and the pet environment, telemedicine is going to allow the family members and the caregiver to join in the consultation, asking questions, provide informations to contribute to their pet's care. So, as so many pet parents have pet care person, like a person who is taking good care of the pet and know all the pet's routine and extra. So having all of them in one place at the same time, it's gonna give the chance for all the vet questions to be answered properly. And at the end, you will reach to the accurate reason for the problem or the accurate diagnostics needed, and so the convenient plan. Adding to all these benefits is gonna help in controlling the chronic disease, as I mentioned in the second type of the telemedicine before. As we usually see during our daily work, how many cases do you have don't show up for a follow-up? I think it's quite very often, and actually this is happening for many reasons. One of these main reasons is that the pet parent have no time or cannot adjust the schedule, which certainly affect our treatment plan at the end, especially when the pet suffering from a chronic disease. Actually, there is a review. It released on 2021. The result of the review found that telemedicine helps providing timely delivery of preventive care to pets with chronic disease, which helps prevent the acute events and the progression of this disease. Some of these chronic disease like diabetes, kidney failure, joint disease. And as we can see, so telemedicine has the ability to help the vet to observe the pet in their natural environment, which allows them to perform more evaluation of the pet's abilities to move around, to interact with the environment and the territory, the litter box, and all these circumstances. This is the part which regarding the benefit to pet parent. So here we are going to discuss what could be the benefits of telemedicine to the vet. How it's gonna affect the vet profession. Is it gonna be an add or it's gonna be a hindrance? I can see that these platforms are offering a lot of solutions to the obstacles and the challenges that we are facing in our daily workload. That's why I prefer to mention these challenges at the beginning of this discussion. For also the new students who are graduating now from the schools, because I used to teach in the university, so I know how they are thinking now. They have no idea how the workload looks like, and they don't have any idea about the challenges that they're gonna face. So technology is offering us a good solution now for these challenges, and we need to use it to solve all the problems that we are facing actually. So regarding the benefits of telemedicine for the vet, it's gonna overcome the high shortage in the vet staff. I think most of us know very well that there is a common challenge now because of the shortage in the vet staff. So it's gonna be a kind of solution. It can fill this gap with the proper training of vets for sure, and using a well-established protocol. It's gonna be a good option to connect the vets worldwide together. It's gonna connect the vets from different countries together. So it's gonna be a kind of solution. Of course, it will not be the complete solution for the shortage, but it's gonna help by a percentage. Of course, it's gonna offer like a new opportunities for the vets to work at home or to work in their free time. So it's gonna be an add definitely. It's gonna be also an easy access way to a specialist. As I mentioned before, if you are in a rush and you have a case, you need to take a decision. So you need to contact a specialist and get the result very soon. So if you have the correct platform, the correct features, you can just go and connect with any of the specialists like neurologist or any of the cardiologist or oncologist, and get the answer quickly, so you can save time and you can save your patient as well. So adding to all this is gonna add an early intervention, of course. and also increase the client engagement. Because if you are available at the proper time that the pet parent prefer, upon his schedule, upon his free time, so he will be encouraged to get in contact with you whenever he feels that he's ready. So it's gonna increase for sure the client engagement due to the flexible scheduling options. And at the end, it's gonna expand, of course, the client base, and it will be a competitive advantage for any facility or any veterinary practice. If you have this option at your veterinary practice, for sure, it's gonna be an ad. And it will offer a streamlined scheduling, and for sure will reduce the waiting time as well. So it's gonna increase the efficacy and the productivity of working in your veterinary practice. So that's how telemedicine is a beneficial tool in different aspects of our veterinary profession. And I believe it's going to be from a need into one of the valid real tools. So now we realized very well what are the benefits for both of us, either the pet parent or the vet. So now I'm thinking how to do it at my, or how to apply it at my veterinary practice. The integration actually is not something difficult. It's super easy, but it needs practice at the beginning. There are some factors, if you apply it properly, it's gonna be so helpful. Some of these factors are the technical factors for sure, like you should have a reliable internet connectivity, a fast and stable internet. You need to use a friendly software. Try to choose a platform that's comfortable for you. Better to use a high quality audio and video for clearer communication and visualization. And of course, cybersecurity measures to save the data and secure the storage, and also the technical support as well. The second factor is the clinical factor, and first of all, clear communication is it's gonna be your gate to the next whole steps. So you need to have an effective patient owner veterinarian interaction anyway. Then you need to do a standard protocols by establishing guidelines. You need to choose and do appropriate case selection. You need to choose the suitable cases for telemedicine. And actually, it's usually done by doing a questionnaire before doing the virtual consultation itself. I'm gonna explain it later. It's one of the important steps before doing the virtual consultation. So you can select either this case is suitable for the telemedicine or is not suitable. We also, regarding the staff, you need to do continuous medical education, do training in order the staff can be confident during the visual consultation. And you need also to do a collaboration with a specialist. It's gonna be amazing if you did this collaboration. You will have, you will be fully packed with all what you need. And third factor is a workflow modification. You need to do a workflow integration in order to ensure a seamless incorporation into existing workflow. You need to do a scheduling and the logistics to avoid the interference, and by doing efficient appointment management. You need to do a comprehensive training support, quality control, and of course monitoring and evaluation of the improvement. So the fourth factor, and is a very important factor, is also the client education. You need to do a client education using a clear instructions and technical assistance. Yes. So the first factor is the client education. By doing clear instructions and technical assistance, you will ensure that the client understands well what he should do before going through this virtual consultation. You need to do also a client satisfaction surveys, like regular feedback collection after you finish the consultation. You need to ensure the accessibility and the convenience by doing flexible scheduling and easy access, and also the trust and confidentiality to maintain the client confidentiality and follow up also to ensure the complete care for the pet. And the last important part in this integration is to take care of the legal considerations, because for sure every state and every country has its own legal consideration. So you need to ensure the license, the confidentiality, the informed consent. You need to ensure all these criteria to be well established and well organized before you integrate these platforms to your practice. So that was a quick wrap for all the factors that the clinic can use for a successful integration. We need now to be more familiarized with the common platforms that are using telemedicine. Actually, we have so many kinds of platforms. First of all, we have these platforms. They are very common in Canada and USA. We have the AirVet, we have the Vetister, Poppy, BetMed, Televet, the First Vet. All these platforms are now working efficiently, and they have a user-friendly and scheduling, billing, like most of the features that you may need in the virtual consultation. You have this kind also of Zoom, Skype, FaceTime, BetChat. These kind of video conference tools are now used actually in the Gulf countries and in Middle East, more common, not the telemedicine platform. We are using here now these video conferences because I'm quite sure that the telemedicine platforms are not well known here in the Gulf countries yet. So now we are depending on these kind of video conferences, and actually we are doing great with this till now, and we are using them very often. There are also another like virtual consultation tools using an AI. It's kind of like Vet Connect, Pet Chat, Vet Help. All these are AI powered. So you are going to contact the AI itself, and there is like a symptom checker. He gonna chat with you, and when there is a serious condition, he gonna direct you or ask you, please contact the vet. It's gonna be better for the health of the pet. So most of these platforms are in the form of a mobile app. You will simply, or the pet parent actually simply is going to download the app and then register the details and account with complete history of the pet. Afterwards, he can simply get in contact with the vet directly, or the AI, depend on the kind of the app that he downloaded. So now you have all the tools to start the telemedicine in an easy and simple way. You have the telemedicine app. You are now familiarized with most of the telemedicine platforms that are very common now. You have the mobile app. You have the additional complementary tools, the wearable devices that you can use to help you. So after having all these, developing a strategy for effective communication and get the team well trained to it will ensure doing it successfully. And this is one of the suggested strategies that you can start with, and you can modify it afterwards. But this is something like a preliminary strategy. You can just read or have a look about it. We have the pre-consultation, we have during consultation, and post-consultation tips. Pre-consultation, you will need to provide the client with clear instructions, which I mean that once you, of course, you're gonna have a team of a vet tech, a team of vets, and these platforms of telemedicine, some of them are doing like integration with some of the veterinary clinics, veterinary hospitals, and when they are in a busy day, they direct the call towards one of these platforms. What's gonna happen is that the vet tech will receive the call from a client. Once he receives the call, then he should give a clear instructions and detailed instructions on the consultation process, the requirements for the whole consultation, the necessary documents, and also he gonna provide the pet parent with a pre-consultation questionnaire. Because this questionnaire can help them to gather the medical history, the symptoms, and the relevant information. And for sure, they will make sure of conducting a technical checks. This is very important pre-consultation. During consultation, we need to be sure of clear communication. You should speak clearly, concisely. You need to do an active listening and pay attention to all the concerns. Ask a clarifying question. Ask an open-ended question. Make sure that you understand the situation very well. You can use also the visual cues like the video conference, or to understand the body language, the facial expression, the bed behavior. You can check how the way he is standing, the way he is moving, the way he is sitting. All this is gonna be an additional information for you during the consultation. You need to do a real-time note-taking by recording like a key points, diagnosis, and treatment plans. And also, for sure, you need to provide emotional support for the pet parent. By doing all the steps during the consultation, you will get the proper answer for your questions. And I believe if you use these techniques in any consultation, it's gonna be successful anyway. But now the important part is the patient part. How I am going to examine the pet on a screen. Definitely, the diagnostic tools are so important, but we are focusing now on the situations that the pet parent seeks help or advice. And at some point, from one look at the pet, you can figure out what's going on with him. Is he in pain? Is he down? Is a problem in his skin, in his eye, in his limbs? For sure, we need the diagnostic tools, and they are the gold standard for everything. We cannot work without it. But I'm focusing now on giving an advice to a pet parent who really needs it, but he cannot come to you. He cannot, for any reason. Maybe you are heavy loaded with appointments. Maybe it's an off day. Maybe it's a break or a common holiday. So there are a lot of reasons that may hinder him from taking an appointment and bring his pet to you. So here is a suggested approach regarding the patient care. After taking the comprehensive medical history and doing the visual examination, you can use the remote diagnostic tools that I have mentioned before, like the remote stethoscope, the remote thermometer. You can use the remote otoscope. So there are a lot of other tools that available now in the market. You can depend on them. And for sure, you are going to educate the pet parent some tips to help you to get the answers that you are seeking for your questions. After getting all this information and all this data, you can either to apply a treatment plan, or if you feel that the diagnostic aids are needed, you will refer him to the local vet or the family vet, mentioning that this condition needs to be more investigated. And here we can realize how important is a pre-consultation questionnaire, because this part is gonna guide you. Is this case really need to be referred to a hospital or an ER, or it's okay, it's gonna be kind of a normal consultation, a normal normal checkup? So it's okay, it's gonna be handled with the telemedicine platform. So this was during the consultation. Afterwards, you have the post consultation. After you finish the consultation, you of course it's like an advice or a recommendation to provide the client with a written summary and follow-up instructions. You can share relevant educational materials and videos. You can give them a solicited feedback to improve the remote consultation services. You can give them an updated electronic health records with consultation details, and you can do a follow-up communication to monitor the patient progress at sure. So to ensure the complete successful process, you will need to ensure the technical consideration, the staffing training, improving the quality, and that was the suggested strategy to ensure a successful smooth service. Here's a case study, if you like to imagine how it goes. This is a case study of a Labrador Retriever. His name is Max. He's 7 years old. He was presented with vomiting, diarrhea, and his owner, Sarah, contacted her veterinarian, Dr. Smith, who offered a telemedicine consultation for any reason. Maybe she wasn't available, maybe she lived in a remote area, or she was traveling with her pet. So she is seeking his advice. So pre-consultation, Sarah completed a questionnaire providing Max's medical history, symptoms, vaccination records, and all the details about Max. Dr. Smith will conduct a 30-minute video consultation observing Max's behavior, the vomiting, observing stool, observing the food and diet. And during the diagnostic discussion, Dr. Smith is asking targeted questions, and Sarah will provide additional information. Regarding the treatment plan, Dr. Smith prescribed anti-nausea medication, fluids, and blended diets. And here we can figure out how successful the outcomes are from telemedicine by being the fast time intervention. So it was like it enabled prompt consultation, reduce the delay in treatment, cost saving. So Sarah was avoided unnecessary clinic visits and potential hospitalization. For sure, it's gonna improve the client satisfaction. As in this case, Sarah appreciated the convenience, the reduced stress, and the personalized care, the effective treatment, as Max recovered in this case study within 48 hours. So from this case study, you can imagine how telemedicine can provide the convenient, timely care, the cost-effective solutions, the enhanced client satisfaction, and the effective treatment outcomes. Now you became familiar with the telemedicine benefits, the uses, successful models, and the approach, how to apply it in the veterinary practice. Now you can start developing a plan for implementing a telemedicine platform in your veterinary clinic. You can evaluate the existing telemedicine platforms and choose which is suitable for you. You can create afterwards the policies, the procedures for telemedicine services that you can do it. So at the end of this discussion, these are the conclusions: that the telemedicine can enhance the patient care, can improve the client satisfaction, can enhance the vet quality. Of course, the work-life balance is gonna be highly improved. It's gonna meet the evolving needs of clients and pets as well. Thank you.
Thank you. Let me put links to your LinkedIn and Instagram. I know you shared that with me earlier. I want to share that with the audience just so
Yeah, sure.
I know we have a shy audience today, as we saw in the beginning. I'm curious if anyone who's been here since the start has any thoughts, though, or questions for Dr. Kandil. I know I have a few things I want to discuss with you based off of my reactions there, but I want to see if any of the audience has any thoughts or things they want to ask you, any other discussion points that they want to, bring up or see your opinion on. So
Yeah, please.
yeah, anyone feel free to mute if you have any questions.
Or they just can text us also if they are somehow shy. You can just
Yeah, that's right.
whatever.
If you wanna put it in the chat, any questions you guys have. In the meantime, I just wanted to say, like, to start, I was very glad to see you bring up Not One More Vet. We love them at Celeritas. I don't know if you had known beforehand that we were doing work with them and ended up making an app for their resources for easier access for people. But yeah, we love them a lot there. And I'm seeing Dr. Moammar is unmuting, but we can't hear you necessarily. If you want to type in the chat whatever your questions are, we're happy to discuss. Yeah, I don't know if your audio is working. Yeah, Amira, the recording will be available. We'll be sharing that with everyone. We'll also be sharing some of the notes that from this. I'm sure if you asked Dr. Kandil if she could share her presentation with you, I'm sure she'd be happy to.
Yeah, sure.
So feel free to reach out to her separately or add her on LinkedIn. I did not get the part of using the remote diagnostics. Yeah.
The remote diagnostics. Yeah. As I explained, there are like three main types of telemedicine. One of them is a kind of storage, and it's kind of sharing the documents between the vet practice and the specialist. The second type is the monitoring type, and this is commonly or mainly used in chronic disease because it depends mainly on the wearable devices. It's there are like so many chronic diseases in the dogs and cats that they need to be monitored, and they need to do follow-ups every now and then. And actually, what we are facing in our profession is that sometimes the pet parent um, is not explaining the symptoms in the correct way. Sometimes they are doing like overestimation, or they are doing like underestimation. So by using these wearable devices, we're gonna get the accurate measurement of whatever we are seeking. Like we are seeking the blood pressure, we are seeking the blood glucose level, the cholesterol, whatever we need, we will get the accurate readings for these parameters, and at the end we will do the correct and the proper decision regarding the situation or the case we have. So this is a kind of an evolution actually in monitoring of the chronic disease. And as I mentioned also in the review in 2021, there was a review stating that these kind of devices, it minimized the acute incidence of this chronic disease.
Yeah, and I know as a topic, it's kind of a confusing one to kind of imagine. I know that the way I kind of relate it for a lot of people is like, for example, with with diabetes, we have things. I personally have like my own monitor here that's like attached to me constantly. I have this here, and it sends all the readings that I get to that from a sensor that I have, gives blood glucose readings to an app in my phone. It connects there, then it connects to a healthcare team that can view that remotely. And so they can do the same thing with pets. They can do the same thing with activity monitors if it's hooked up to different.
Exactly. There are also watches. There are so many watches now reading, and actually, I know some of vets, they are still doubtful about using these devices, but in any way, you need to try it. You need to try it in order to do your decision after, because we will never know how they are useful unless we try them and we say our feedbacks. This is the first thing. The second thing, I can believe that these devices will be more accurate than what I am hearing from the pet parents. Not all of them can understand well what's going on with their pets. They already have their lives, their busy work schedules, so not all of them can focus with them. Sometimes they have the pet care person, a person who is taking care of the pet, feeding him, doing all the schedule for the pet, and I cannot like take all the information from one person. So it's really something not easy for us. That's why I believe our profession is not something easy. We need to have the skilled, highly skilled guessing, highly skilled to connect the dots between what I'm hearing from this one, what I'm hearing from this one, and at the end I get a conclusion for what I have in front of me.
That's right. And I think as wearable technology for pets gets more sophisticated, I think that that'll open up a whole new world of being able to remote monitor pets. I think right now there's a lot of colleges that are doing enhancements to technology that we already have for wearable devices, but making them specific to small animals. Because a lot of the motion detection software that we have is all based off of human motion detection. This is, so this is a completely new world that we're diving into, where we're saying, well, we have to monitor animal movements and have sensors based off of that. And so the technology is constantly evolving to kind of bridge this gap between, communication that we've never been able to kind of bridge the gap. If veterinarians are the only people that are treating the voiceless, it's not like the pet can tell us like, oh, we're itching this many times a day, or here are our vitals. I checked my temperature. This is how I'm feeling. So I think as we continue to use technology like that and innovate, I think it's going to be a great service to people doing telemedicine. So I'm glad that you brought up the discussion that we did with Dr. Roth as well. I linked that in the chat, but that was a great conversation. I had so much fun with that one too. And
actually, I watched the webinar with Dr. Ross and it was amazing. I liked all the technologies that she explained in the webinar that time, and I liked also to have the option to try it. But now in the Gulf countries, we don't have these, I think, these devices now. But looking forward to try it soon, because actually our profession is we have a lot of challenges in it, and using the technology to solve even half of these challenges is gonna be more peaceful minds.
That's absolutely right. Have you ever spoken with Dr. Roth?
No, not really.
You guys should definitely speak. If you like that, I would love to connect you guys, just have a conversation about that. But I also thought it was great that you're bringing up. Also, I made a note of this. You said something about the laws and regulations behind telemedicine, and just being aware of what those local laws and regulations are. And it's something that's constantly changing too. I know I had
Exactly.
Yeah,
exactly. You need to be aware first before integrate these platforms to your veterinary practice about the legal consideration in your country, because this is something worldwide and every country has its own legal considerations. So you have to be sure that you are following these instructions first, of course.
That's right. And I think it's in its early stages everywhere. So that means that these kinds of regulations are just constantly changing. I'm curious to know if you have any kind of thoughts or predictions on how it might evolve in the UAE for the next year.
Look, now we are using Zoom consultation mainly. I feel like it's kind of filling somehow some of the gaps, but we need to speak more up with the vets. We need to raise awareness with the pet owners to get them more educated about the new platforms. But whenever they are try it for the first time, they are asking to do it after. Actually, I was working in my main country before moving to UAE, and I had so many clients there. And when I moved with my family here, so many of my clients, they are contacting me and they asking me to do a Zoom consultation to get my advice for whatever they have, even though they have the vet there and they have a new vet, it's fine, but they get attached to you and their pet is getting attached to you, so they recommend, it's okay, I have my vet, but I like to know more from you. Of course, I'm always welcoming to do that. And what I found, that they are asking to do that, actually they are the one who are asking me, please we can do a Zoom, please we can do a consultation over the phone. So when I thought about telemedicine, it's gonna be a huge solution, and actually it became a need. Now all the people are connected worldwide so easily, so it's gonna be one of the main tools that we're gonna depend on it on our daily work.
Yeah, I fully agree. And that's so interesting to hear that you're still keeping in contact with people, countries away. It's
Yeah.
huge, and wouldn't be possible without technology like this. So I really appreciate you, first off, being our first guest of the new year and our first conversation.
Yeah, happy new year.
And making that conversation about telemedicine. I hope everyone enjoyed this. Like I said, there will be a recording of the restream that we will send out to everyone. We'll have some of the key highlights from this discussion as well. I've linked many things in the chat while we've been speaking, including Dr. Kandil's LinkedIn and Instagram. So feel free to add her there. And let me put my LinkedIn as well. I would love to connect with everyone who's joined today, just so we can stay in contact and we can keep you informed on when we do our next discussion. But thank you again, Dr. Kandil, for joining. I truly appreciate it.
Thank you, Danielle. Thank you for the team. Thank you for all the participants here. I'm very glad that I can see here some of my colleagues. I'm very glad to see them there. And hopefully in the future, we're gonna have some of these platforms here in Dubai. And I'm looking forward to apply one of these platforms in the veterinary practice anyway.
Great. Thank you so much.
Thank
you,
you.
everyone who's joined. I hope you have a good rest of your
Thank you.
day.
Thank you.
Bye.
Good night. Bye.